Hello everyone, I am Dr. Vishwa Dave and I work as an OPD manager in HCG Cancer Center, Ahmedabad. Today we are here to discuss about the current status of the robotic surgeries in genitourinary cancers. We have with us Dr. Hemang Bakshi and Dr. Vipul Tilva, who are the consultant Uro-Onco robotic surgeons at HCG Cancer Center, Ahmedabad. So Dr. Bakshi, my first question to you is, your team just completed 1000 robotic surgeries in uro-oncology. What is the current status of robotic surgeries in urinary tract cancers?
So robotic surgery is not some futuristic technology which is about to be there in the next coming years. It is already there. It has redefined healthcare since the year 2000 when the first robotic surgery was performed, right? And ever since the last 25 years, the progress of robotic surgery has been tremendous. It is growing at about 15% every year, and every 16 seconds in the world, some robotic surgery is started. So that's a great volume of robotic surgery is being performed. And the robotic surgery market is growing and expected to be touching $27 billion in the year 2032. And the growth rate is, as I said, 15% per year. So it's a technology which is growing at an exponential speed. And even in countries which are developing, like our country, in the last few years, it has expanded a great deal and it is still continuing to expand.
Dr. Tilva, are the perceived benefits of robotic surgery truly clinically significant?
Yes, of course. It's not just a keyhole surgery where we will do the surgery through the keyhole, and it's not just a cosmetic surgery. But what we will achieve, we will pursue through this keyhole surgery is better cancer control. We remove the cancer at the sub-millimeter stage, so it is less than centimeter stage. And also, we'll prevent the collateral damage to the surrounding tissue. At the same time, many patients doesn't require any blood, and faster recovery of the patient, as well as less hospital stay and less use of antibiotic. So it's a truly beneficial for the patient. If I will say in simple word, it's an optimum control of cancer along with better functional recovery and less hospital stay and better recovery. If you take an example like a kidney cancer, if you say, so smaller tumor in kidney cancer, we can remove cancer along with preserving better kidney functions. Each unit of kidney tissue can be preserved along with the optimum control of cancer.
So in the current form, the robotic surgery system is a master-slave system where the surgeon controls the robot. The surgeon performs certain tasks of the surgery through the console by moving his fingers inside the console. And those movements which a surgeon does, they are transmitted into the robotic arms inside the patient's body. So, robot does not independently perform surgery. It is the surgeon who controls the robotic arms. As far as autonomy goes, the robot is not at all autonomous, and complete autonomy, we are not there yet. So in future, we might have a technology where a surgeon feeds the patient's data into the robot the previous night of the operation, for example. And the next day, the patient is prepared and the robot performs the complete operation by itself. And the surgeon just supervises or changes when there is a necessity of change or deviation from the standard protocol which is fed. But right now, that level of expertise in technology is not there. So the fear sometimes that the robot may malfunction and carry out certain independent tasks, is completely unfounded. It doesn't happen, and it is the surgeon who completely controls the robot.
Dr. Vipul,
Yes.
after all it's a machine.
Yes.
How frequent is this robotic malfunction in surgeries?
So yeah, your point is valid. So everyone have a fear sometimes during surgery if malfunction happens and robot will stop working. Actually, practically it is very rare. We have a John Hopkins data in this institute maximum number of robots, like 84 robotic platform in a single hospital. They calculated the data. They did the 50,000 robotic procedure And out of 50,000 robotic procedure, malfunction happens only in 0.38%. So it's a very negligible percentage, right? So if you compare what we have a chance during our car driving, the chances of car crash and accidental death, it is 5 to 6 times higher than this percentage. So in my view, it's a very less chance of malfunction. However, it might happen. There are two types of fault might happen during surgery. One is recoverable fault and second one is non-recoverable fault. Recoverable fault where during short period of time, robot automatically become recover and we carry out the procedure. And another malfunction is non-recoverable, from where we cannot recover the robot completely and we have to convert this procedure. So if we are in initial stage of surgery, we can stop the surgery, we can come on another day. And if we are at the mid of the surgery, so safely we can convert the robotic procedure into the laparoscopic procedure or into the open procedure without harming the patient.
Dr. Bakshi, lots of patients face confusion as to which method is best for urinary tract cancer surgeries. Which do you think is the best method, laparoscopic, open or robotic?
That's a good question, Dr. Vishwa. So, before just say 10 years back, when the robotic technology was relatively new and not established into 15 years back, there used to be a lot of confusion, like open surgery proponents would say that open is better, people were doing laparoscopic surgeries for prostate cancer and they used to feel that laparoscopy is as good. And as the number of robotic surgeries started to increase, there have been randomized studies in prostate cancer, in bladder cancer, kidney cancer, where head-to-head comparisons between all the techniques were made. And that debate has now relegated to a thing of the past. Now that debate is no longer relevant about which method is better, because robotic surgery has clearly outperformed open and laparoscopic methods in the treatment of prostate cancer, in kidney cancer, and in some bladder cancer cases as well. So if you take prostate cancer, for example, the best advantage of robotic surgery is in terms of recovery of not just the patient getting early discharge from the hospital, but urinary control is recovered much faster, and sexual function is also recovering much faster after robotic surgery as compared to open and laparoscopic methods. And having done all three ourselves, we have been doing open, laparoscopic and robotic surgeries for prostate cancer since about 3 decades now. And analyzing my own data, I would feel that robotic surgery is giving much better results than open and laparoscopy for prostate cancer. Now coming to kidney cancer again, what advantages robotic surgery gives, apart from general advantages like keyhole surgery, minimal bleeding, etc. The main advantage is in being able to perform kidney cancer surgeries for complex renal tumors and preserve the kidney. You know, larger renal tumors, for example, 4 to 6 centimeters tumors, previously used to be treated by a complete removal of the kidney or radical nephrectomy. Now, we are able to save the kidney and remove the cancer in this kidney without compromising on cancer control. So that's a huge thing. If a robot can save the kidney better, then that's a huge thing, and we believe it does. And studies have proved that as well. And in bladder cancer surgeries also, robotic surgeries are increasingly performed for complex procedures like making a new bladder out of the intestine of the patient. So overall, in urological cancers, robotic surgery is the preferred method of surgery where there is an access for the patient to the robot and to an expert surgeon who can perform these surgeries well.
So Dr. Vipul, as we all know, robotic surgery is expensive. So how it is possible for an Indian patient to have access to this technology?
According to Indian perspective, this question is very good. If we think about laparoscopic or open surgery, comparing with the robotic surgery, cost difference is around 1 to 1.5 lakhs. But anyway, any newer technology have their own cost. Robotic technology is newer. Only few companies is working in a world or in India. So eventually this cost will reduce. If you think on another way, like in robotic surgery, the patient will get discharged very early, faster recovery, less blood loss, less use of antibiotic, early return to their own wards. If we compare this cost and the cost of surgery, the difference is minimal. So in my view, yes, robotic surgery is a bit more expensive as compared to lap and open, but eventually this difference is not too much significant.
So, Dr. Bakshi, what are the factors a patient should keep in mind while choosing a robotic surgeon for his or her treatment?
That's a good question, because merely having a robot in the hospital does not guarantee a successful outcome for the surgery. The man behind the machine is more important than the machine itself. The machine helps in carrying out the surgery, but the surgeon himself is responsible for the outcome. So the expertise of the surgeon, the experience of the surgeon, and his knowledge of anatomy of the surgery which he's going to do, all are very important in the ultimate outcome of the patient as regards cancer control, as regards functional recovery. So for a patient, when he or she is about to select the surgeon, they should have a thorough knowledge and they should exercise due diligence in researching the hospital's robot, what kind of robot they have, the surgeon's credentials, what his or her experience is regarding the technology, how many procedures the surgeon has done, since how many years is he practicing, etc. So these are important points to consider for the patient and the relatives while choosing a hospital and a surgeon for their surgery. We have to remember that a fool with a tool is still a fool. So the man driving the machine is very important, and it is important to choose the right surgeon with the right technology at the right hospital. That will ensure good outcomes.
So, Dr. Vipul, what do you think is the future of robotic surgery in uro-oncology in the next few years?
So, yes, practically I don't know, but in my mind, I think that AI-generated robot will be our next future in next 10 years, where robot will decide where to cut, how long we have to cut, and it will also give guide to the surgeon where to stop and how far your important organ is there, as well as robot will have some memory chips which is fed with thousands of MRI and CT scan, so it will be a more precise surgery and might be a more autonomy. And in my view, the days are not far where surgeon will sit away from the robot and only robot will do the surgery. As you know, nowadays it is a highly classified machine with loaded advanced medical instrument with better vision, but robot will not cut or not do surgery by itself. Surgeon will guide the surgery and it will do the surgery. So it's a modified machine or it's a tool.
Well, thank you so much, Dr. Bakshi and Dr. Vipul, for having this insightful conversation with us about robotic surgery in uro-oncology that we had today.